I know diabetes is something has something to do with sugar itself, nothing else really.
Well, I just know when you take too much sugar, you get diabetes.
I try and eat healthy, try and eat a bit healthier. I don't have sugar in tea or nothing.
Most of the healthcare professionals refer the blood glucose as blood sugars. So the people with diabetes think, as long as I don't have sugar, my diabetes is hunky-dory. But that's where they get shocked when the slice of bread changes into blood glucose exactly the way at 3 teaspoons of sugar. They just penny drops for them.
Carb counting sounds like some sort of dark art, but in actual fact it's a skill that lies at the heart of good diabetes management. Today, in Glencroyd Hospital, a group of patients have been invited to learn more about it.
Would you come this way, please?
Mine's not bad, but it's took a few years. 16 years now I've been diagnosed. I'll say the first 4 or 5 years it was terrible, but the more you get used to it, the better it is and easier it is.
If you can really get to grips with knowing how much carbohydrate there is in each morsel of food you eat, you can match your insulin much more effectively and start to avoid the highs and lows of getting it wrong. It can be a pain to start with, but you very quickly remember that a piece of your usual bread is 15 grams, your mum's Victoria sponge is 75 grams a slice. And as it becomes second nature, so life and your blood glucose will settle into a regular pattern.
So we have 3 main food groups: fat, protein, and finally carbohydrates. So examples of fats: lard, butter, margarine. Any oils, whether it's olive oil, sunflower oil, they're fats. Next one, protein. Anything that moves is protein, yeah? And eggs. But if you're looking for vegetarian source of proteins or nuts, pulses like kidney beans, those kind of things. So what about carbohydrates? What are the carbohydrates?
You probably already know that things like potato, pasta and bread are carbohydrates.
It's surprising what had a lot of carbohydrate. Yams. Yams are very, very... I had a yam last night and I had to take a dose of 8 just for a yam.
Milk, yoghurt and fruit contain naturally occurring sugars. They count as a carb too and need balancing with insulin to allow your body to use the blood glucose they generate inside you.
These are all the carbohydrates now, guys. The key message you need to take home is whether you have starches or sugar, carbohydrates, you need your quick-acting insulin.
If on a weekend I'm not having a glass of wine or something like that, I'll have a large glass of orange juice in the past. And when you get diabetes and they tell you, if that glass takes 10 oranges, would you eat 10 oranges? No. So why are you drinking 10 oranges worth of orange juice? Whether you've got diabetes or whether you're a normal person, you really shouldn't be whacking a pint of orange juice in your system. And that's something that I learned and I thought, oh yeah, that makes sense.
In the early stages, many people are surprised when their breakfast sends their blood glucose levels soaring. James has had diabetes for less than a year.
I have mixed breakfasts, I have different stuff every day and stuff like that. But I never knew how much carbs and stuff are in it.
Does anyone have brown flakes as their breakfast?
Yeah, sometimes.
Yeah. Okay. I want you to pour your portion, okay?
So I'd have I'd say that much.
What's it says?
62.
62 grams. We'll say 60 grams then, yeah? So that's 40 grams of carbs. And then you pour at least 1 glass of milk. That's 10 to 20 grams of carbs. And then if someone slices a banana on the top, that's another 20 grams of carbs. Do you see my point? How we're adding on to it. So if you don't take enough insulin, you're not going to get good control, are you?
No.
This is where your carb counting skills are essential.
For some people, 1 unit of insulin will balance 10 grams of carbohydrate. If that's you, you'd need about 8 units for that breakfast with a carb count of 80 grams. But for others, 1 unit might balance 15 grams of carbohydrate, and it might vary between the morning and evening. Your dietitian will help you work it out, and getting used to it will mean that the control of your diabetes will be better. But no matter what your ratios are, all carbohydrates count, whether they're sweet or savoury.
You would have these crisps because you think they're not sweet, isn't it? They don't have enough sugar in them. But these crisps would raise your blood glucose more than a single Time Out or a Freddo, isn't it? Yeah?
If you have too much glucose in your body after eating, with time it'll damage the lining of the tiny blood vessels in your eyes, your kidneys, your feet, your liver. It's a good reason to count those carbs carefully. Get looking at labels.
In the UK, the label reads carbohydrates of which sugars. That's how it reads. So when you want to take insulin for your carbohydrates, you want the total carbohydrates, not just the sugars. Okay? So ignore the sugar bit and take the total carbohydrates. So per pack sandwich, how many, guys?
29.8.
Shall we say 30 grams then?
Yeah.
Well done.
There are carb counting tables, carbohydrate scales. I found some helpful reviews on the diabetes.co.uk forum, and they have really useful advice there on eating out. If you're partial to a burger and chips, pizza, things out of the deep fat fryer, do remember that too much fat causes weight gain, which in turn will increase your resistance to insulin, meaning that you might end up having to have more insulin to stay in balance. So do keep an eye on your diet and your weight.
Definitely important to get educated. I thought I was educated. Obviously I wasn't. Not as much as what I found out today. And that's just been, an hour and a half. And I've learned so much.